So my first video got cut off a little bit, but I'm still going to go ahead and give my subcutaneous injections. So I'm going to go over the sites real fast. The best sites for subcutaneous injections are you have some here on your arms and the lateral aspects of that area, both sides. You can also give it on the back sides of your shoulders, right in the area. You want to avoid the right on the scapula because you don't want to hit any super bony areas, but there's a nice little section right there you can give them. Also on your lower back, there's a few little spots. You can go right through here, being sure to stay away from the spine, but there are some little areas right there where you can give on each side. You can give it on the lower abdomen. Be sure to stay away at least 2 inches away from the belly button, just because it's a really it can be a sensitive area, especially with medications such as like heparin. You want to be able to stay clear of that. And then of course you can also give them on the anterior aspects of both of the thighs. Alright, so we're going to go ahead and get started on our subcutaneous. What we're going to do is I'm going to do insulin today. So I have my insulin needle, I have these, I've checked and verified both of their expiration dates and they are good to go. I'm going to go ahead and take my needle out. I'm using a 5/8 inch length, and then this is also a 28 gauge needle, which is appropriate for insulin and subcutaneous injection. So I'm going to go ahead by just cleaning these off. I'm going to grab one more new one. And then I'm going to go ahead and go to a different area and clean this one. Okay. And so my order said I need 16 of the NPH and 9 of the regular. So I'm going to go ahead and inject 16 units of air into my NPH. And I do have another nurse here with me so she can see everything that I'm doing. Okay. And then I'm going to do 9 to this one. Alright, and with this one, I'm going to go ahead and invert it and pull back that 9 that I need. Oh, little bubble. Just get that out. Okay. Alright, and then I'm going to go ahead and recap for a minute. And I'm just going to mix up my insulin. When I go to pull up the insulin out of the NPH one, it's important not to mix them because they're different types of insulin, and then you have to throw them out because it'd be ruined. Also, when you're doing insulin, you want to be able to check your patient's glucose levels before you give it to them and make sure that they have some sort of food or something like that on the floor so that as soon as they get it, they have something they can eat. Alright, I'm going to go ahead and just clean my patients off real fast. Okay. Alright. Open this. I'm going to go ahead and just poke there. And then I'm going to pull out the rest, so I'm going to go to a 25 total. Nice and slow. One little bubble there. Alright, pull that out. And then my nurse can verify I'm at the 25. Looks good. Okay. So with an insulin, typically it's at a 45-degree angle is what you give it at. But if you have a bigger patient or something, certain situations, you may have to give it at a 90 degree as well. So I'm just going to go ahead and stabilize the tissue. I'm going to go ahead and insert at the 45. Slowly inject medication. Give it just a second. And then pull out. And that is a subcutaneous injection.